Well, hello class, and welcome to Module 6. During this module, we will be talking about children who have cognitive impairments and intellectual disabilities, including children with developmental delays, autism spectrum disorder or ASD, and Down syndrome. Also, caring for children with visual impairments and hearing impairments will also be discussed. So pediatric nurses always need to be aware of the possibility that a child may have a cognitive impairment or a developmental disability. So when they're coming in for all of their regular visits at 2 months, 4 months, 6 months, 9 months, and you're looking for those milestones, that's what you're looking for. You're looking for not to see who's the first one in the family to get to walk first, but to compare those developmental milestones to this child and hopefully be able to pick up if they are not meeting their milestones. At 9 months, are they not pulling themselves to a stand? At 12 months, are they not standing by themselves? At 3, are they not starting to ride a tricycle, speaking well, those types of things? How are they playing with their peers? All those things can be signs of cognitive impairments, developmental delays. So it's a pediatric nurse's responsibility to recognize that along with the providers so you can recognize what it is and refer that child to the specialist so they can get a diagnosis and get started on early intervention therapies. So remember that kids are not always going to perform these activities when they're in the office. So it's up to the pediatric nurse to not only observe the child for these behaviors, but also to be looking and asking the parents or the caregivers questions. Because that you may have a very shy child, a child that is experiencing separation anxiety and clinging onto their parent. So you might not be able to see them at their best. So you're going to be asking the parent, are they walking? Are they talking? Are they playing with their peers? Are they hopping on one foot? Whatever the developmental milestone is for that age, the nurse needs to be asking those parents or caregivers those questions. And anytime there's any red flags, no, they're not starting to walk, or no, they're not starting to talk, then that definitely warrants further investigation. Okay. Autism spectrum disorder. In 2018, the CDC determined that approximately 1 in every 59 children is diagnosed with autism spectrum disorder. And boys are 4 times more likely to be diagnosed with autism than girls. So pediatric nurses do need to be screening for autism, and the American Academy of Pediatrics recommends that children receive those regular developmental screenings and an autism screening at 9 months, 18 months, and 30 months, so they can pick that up. There are a number of screening tools that the pediatric nurse or provider can use in order to diagnose or to at least determine if there is further investigation that needs to occur for a child with showing signs of autism. And then once a child is thought that maybe there is something that looks like autism, that child does need to get referred to a specialist. Now, children with Down syndrome are special kids that need specialized care also. The pediatric nurse will be recommending and or coordinating care between a lot of different providers. That's OT, occupational therapy, PT, physical therapy, speech therapy, social work, early intervention, and a lot of other specialized care providers, including possibly, depending on the child's health status, a cardiologist, orthopedic provider, and pulmonologists as well. And then lastly, nurses also need to recognize the warning signs that an infant may have a hearing impairment or a visual impairment. So look out for those as you're doing your readings. Make sure you're picking up what those are. And then once a child is diagnosed with a hearing impairment or a vision impairment, the pediatric nurse, when that child is hospitalized, really needs to be able to understand how you care for that child because they're so vulnerable. You want to be able to provide the best care you possibly can for all of these children when they are under your care. You need to think about them in a little bit of a different way. Okay? Well, enjoy Module 6. Bye.